Wonderful. Sorry. Hi, everybody. I'm Olimpia Pantelimon, and
I'm Ray Copes.
and we also have David Steeb. I'm not sure if he's going to be on online with the teleconference, but we try to put together some of the ideas and questions we have for a knowledge transfer and exchange group. Basically, we've asked ourselves a number of questions and what we want to achieve, what are the priorities, and we also wanted to bring forward some of the experiences we've had in relation to knowledge translation and exchange from previous projects with Canadian Institute planners. In previous experiences, we've worked on a number of tools that were dedicated to professional planners from coast to coast to coast that are available online. And in terms of that, the idea is that we wanted to better understand how we as professionals, health professionals and planners, we work together, as Jeff mentioned earlier, for developing a healthier built environment and how that can be performed. And basically, we need to understand, and we need to go a little bit on a much more holistical perspective and bring together all the areas of expertise into a systems approach or a holistic approach back to the roots of urban planning and understand what the benefits are. And also, if we said, and yesterday we talked about some sort of lacking the evidence for health professionals, I wouldn't say that we lack the evidence, rather than we don't know or we don't have it handy into the right hands and into the right people that are needing it. So a healthy community from a planner perspective, this is what we shared in a number of conferences and with the projects we achieved on healthy communities. And as well, all the time going back and forth and with the cycle, identifying new trends related to healthy communities. And as I mentioned, the question or the big question was, how did we get today with what we have in terms of suburbs and congestion and everything? Well, if we go back to the roots at Patrick Guides or the models of Corbusier or the models of urban planning, the Garden City, we wanted to move away from the polluted downtown centers and industrial mixture of uses to a new form of healthier built environment that at the time was thought to be the suburbs. Now, we need to understand what the context is and evolve and use what we have and what we achieve today to move forward. These are a number of tools that we have achieved and are available online, including a survey that we have conducted to understand what the current gaps are in achieving healthier communities. And we wanted to understand how we can move forward in terms of what others are doing in terms of healthy community. And we went about understanding what the Société Française des Urbanistes, they do in France, what in UK the Royal Town Planning Institute does in terms of policy for healthier built environment, as well as American Planning Association. So coming back to our questions in our group, we wanted to bring forward a number of questions and understand what the perceived or real obstacles are in terms of weak or unknown evidence that links the built environment with health. We talked about correlation versus causation, a lack of systems approach or cohesive approach in incorporating health benefits in planning, decision making, and poor collaboration in between planners, health departments, and others, or lack of clear, tangible definition of narrow disease-driven on defining the community health, lack of political or community development industry awareness and support, and resistance to change. A number of desired resources or outcomes that were identified are webinars and courses, evidence reviews, tool baskets, and example of best practices, guidelines, policies, dialogue with across organizations, understanding the jurisdiction, vertical and horizontal, continued dialogue with the responsible jurisdiction, have policy and legislation with the aim of having a stronger language into requirements. So for instance, an example is we have now health impact assessments that are applied with a various degree from coast to coast. Now, where it cannot be used as a standalone tool, is there any benefit to consider it, as in UK, for instance, to incorporate it into the environmental impact assessment and have those health benefits considered? That's a question. And of course, enhance public and political awareness. Some of the objectives, we also talked today, would be will be identified as well through the strategic sessions we're going to have. Meeting the need, a common ground in between needs for planners and other knowledge users and health professionals. Findings and building the evidence and informing both planning practices, health professionals for healthier built environment. Now, we've put together a number of short-term and medium-term and long-term benefits. Some of those that we talked as well in the morning were consultation with knowledge user, refined scope of knowledge for the user community, identifying the gaps and the learning needs, mapping the baseline and existing data related to exposure and disease, resource for knowledge users, and updates during the life cycle of CANUE, priorities related to most relevant and current data on health determinants, webinar series, and having direct engagement between different knowledge users, researchers, and mix of presentations, partner with existing stakeholders at the federal or national level that will promote from coast to coast those initiatives that we will be achieving. And for instance, we've mentioned Federation of Canadian Municipalities, or through universities, or even journals, identify those stakeholders that would be able to promote what we are achieving. Well, I think this would move on with the work that we have done this morning. And we were talking about, depending on what we want to achieve or the specific topic, what are the stakeholders and the jurisdiction that we want to reach out, and we talk about policymaker, government with different levels, municipal, provincial, and federal. We talk about the research group, universities, and research institutes. We talked about professionals, and then we have professional bodies such as the College of Medicine, the engineers and their professional body, the architects, landscape architects, professional planners, Canadian staff planners. And as well, another important stakeholder into the equation is the NGO, the advocacy groups, and media. And according to what we want to achieve, we put into a number of items, deliverables that we already talked about. And we've heard about like risk maps, guidelines and standards of practice, train the trainer, building the evidence and the findings, tools for a quick speak, fact sheets on specific topics, and having a straight communication strategy and press release. And understand how do we manage the products, the knowledge transfer products, connect and have the continuous connection in between all the groups who are going to use the products, and how do we how we're going to improve the products together. I would pass on to Ray for
Great.
some final remarks.
Great. Thanks, Olimpia. Well, it's a fantastic meeting here, and I mean, some of the ideas over the last 2 days, really, really exciting stuff. And I think it's excellent that we're seeing some people here that we don't usually see at these meetings, so certainly the input from the planning community, I think, has been a real plus. I talk a bit with planners, but I've probably learned more in the last couple of days than in the last couple of years. But there are 3 words that I've heard here today that are more important than any other words. So what and focus, okay? Because there's all this excitement, all this neat stuff we could do, but we can't do it all. And I think the challenge here for CANUE is to demonstrate our impact within 5 years. And I think that does mean that we have to look very strategically at what it is we're trying to do. So a couple of things that I haven't heard are sort of policy cycles or election cycles, and that there are windows where you can influence policy. Haven't heard much about evaluation or interventions, and I think that's really, really important as well to focus on. And you know, I think that is probably where we need to look very carefully. Logic models are very important, and looking at, you know, what are some of the inputs that we need for better research. And I think, you know, we're all excited here about the opportunity to have better access to information for better research, but I think we also want to focus or target that research more effectively on what are some of the really important policy decisions that we can influence over the next 5 years. So that kind of alignment. And you know, I think there's lots of fantastic research that is excellent research, and I look at those studies and I say, really excellent stuff. The practicality or the actionability of that, somewhat questionable. Policy decisions, I see a lot of those being made, and sometimes I look at that policy decision and say, man, they really didn't consider the health impacts. They should have had a bigger component of health evidence influencing that decision. For some of those other decisions I look at and I say, you know, that was a decision that was made almost exclusively on grounds other than health, and that's as it should be. So I think we need to be very, very careful in thinking that somehow health is an important part of all policy decisions. I don't think it is, and I think we need to target those policy decisions where health is currently lacking or not being adequately considered as a factor in the policy decision. I heard another really important term here, and that's mechanism. And a lot of us, I mean, particularly in the air pollution field, want to understand what's behind some of those macro level associations between exposure to common air pollutants and a myriad of different health outcomes. How does that work? What's the mechanism? We've painted in a lot of those pictures. I think folks in this room too, if they want to have more impact from their research, need to think very carefully about what is the mechanism of policy development and decision making. And that is a really important mechanism for us to understand if we want research to have impact. We also talk about policy in kind of real macro terms. Everyone here loves big P policy and let's go to Ottawa and change the country. I mean, the reality is that those decisions are being made at multiple levels, okay? So we're interested in influencing decisions not just nationally, but provincially, locally, regionally, and I would suggest individually. And that's where I think some of the synergy between big data and cohort studies is really important. And, the decisions we want to influence for healthy cities and healthy Canadians in cities does require some big P policy impacts. It also means we look at influencing individual behavior and decision making. Some of the really exciting things we heard about yesterday, the walk shed, the bike shed. These are practical tools that individual Canadians can think about. How long do I want to spend in my daily commute between where I live and where I work, and how am I going to get there? And I mean, taking some of the fantastic information that we've got and working it into tools, not just for people at the national, provincial, local level, but also individual Canadians, I think can have a huge impact. And that means thinking really, really strategically, and I'm glad that Diana led us through some of that thinking, and I think we've got a heck of a lot more that we can do in the next few months. This is a fantastic, exciting opportunity. We've got 5 years. Let's show we really make an impact, and this is just the beginning, and we will go on from there. Internationally, Canada will be a leader. The measure of success is not just the number of international collaborations, how many countries follow Canada in putting together a CANUE or something similar.